Hello doctors, I welcome you to my 6th lecture of series on diseases caused by gram-positive bacteria. And in this lecture, I will take you through the microbiology, epidemiology, etiology, pathogenesis, clinical features, treatment, diagnosis, prevention and progress of the disease caused by Clostridium tetanus. I have used standard books such as Melnick and Edelberg's for microbiology and Harrison for all the concepts of internal medicine. And this much is must if you want to go back to India and clear the next exam. And guys, for better visuality of what I have written, watch my lectures on full screen, and better if you watch them on better quality on YouTube. So let's get started. Microbiology. Tetanus, Clostridium tetanus. Basically, the Clostridium species of bacteria is gram-positive, round-headed rods. These are spore-forming, which forms 3 kinds of spores that can be terminal, central and even subterminal. They are motile. They have peritracheous flagella. The example of motility is the swamp motility, which is shown by Clostridium septicum, and the example of non-motile is Clostridium perfringens. They can be anaerobic. They mainly are anaerobic, and they also can be aerotolerant, but they does not proliferate in aerobic media. They need blood enriched media, and that should be anaerobic. They are the one which causes beta hemolysis and special hemolysis, that is double zone beta hemolysis caused by Clostridium perfringens. They are saccharolytic, which means they can ferment all kind of sugars. They are proteolytic. How do we know that? Because they form stormy froth on milk. Epidemiology and etiology. So epidemiology is divided based on non-toxic strains and the toxic strains of Clostridium. The non-toxic strains are present as commensal in our gut. They can be normal inhabitant of the gut, but the toxic strains can also be the inhabitant but in cattle and horses. And these toxic strains forms spore in their gut and are excreted with their dung or fecal matter. They are present normally in soil, basically the moist and fertile soil. They are not found generally in deserty and sandy soil. And they can be present on metal surfaces, the spores. Now the etiology. They generally enter the body through wound or abrasion. But the disease caused by tetanus is very rare nowadays because of massive vaccination drive all over the world. But the countries or the individuals which have incomplete vaccination are at high risk. Individuals who are more than 60 years, IV drug users living in poor hygiene, and countries with low income are also at high risk. Individuals with complete vaccination do not get this disease. Pathogenesis. In 70% of cases, tetanus enters through the soiled wound or normal abrasion. And the spore will enter the wound. Within the wound, it will form, or if it gets an anaerobic environment, it will start proliferating. Then, on proliferation, it will start producing tetanospasmin, which will show local tetanus symptoms and on getting absorbed will show the generalized tetanus symptoms. We'll talk about it. The toxicology of tetanospasmin. Tetanospasmin have two fragments, fragment A and fragment B. The fragment A is a pH-dependent endopeptide, which means it needs at least a neutral pH so that it can work. What it does, the fragment A causes lysis of VAMP molecules, which are also known as synaptobrevins. What synaptobrevins does? They are important for generating the signal and for releasing of GABAergic signals, which are inhibitory signals. In absence of VAMP or synaptobrevin, GABA will not be released and inhibitory signals will be absent, which will further lead to spasm of the muscles in the local area near the wound. And the fragment B, what it does? It secures fragment A, it provides it neutral pH. Fragment B has a carboxylic side. By using it, it binds to the polycyanoganglioside of the nerve cell membrane. What it is the internalin receptor which gives entry to fragment B. Fragment B is wrapping over the fragment A, so both the fragments are entering through the internalins. Which kind of entry it is? It is called a retrograde transfer. How? Because fragment B will generally bind to the nerve ending, and then from the nerve ending it will reach towards the cell body. That's why we call it retrograde transfer. From there, now later it will get stored into the motor nuclei and the autonomic nuclei. The motor nuclei are, when this tetanospasmin gets stored in motor nuclei, they will be inhibited. They won't be able to release the inhibitory signals, and the massive excitatory signals in the muscles will cause spastic paralysis and respiratory failure by causing spasm of the respiratory muscles. It will also get stored in the autonomic nuclei, from where it will cause massive release of catecholamines that will cause cardiac manifestations such as bradycardia and tachycardia. Features are generally seen after either a superficial injury such as soiled wound or abrasion, or a deep injury, that is abortion and open fractures. Clinical features are divided into local and general features. Local features are, as such, they are seen near the wound area, and severe spasm that can sometimes lead to fracture also will be seen in that limited area. But in most of the cases it has been seen that it generally involves cranial nerves, basically the facial nerves, and it will lead to lockjaw spasm, spasm of facial muscles, laryngeal and pharyngeal spasm that again becomes deadly because of obstruction of respiration. And in neonates, a specific feature, that is reduction in their capability of sucking milk, will be seen. The generalized features will involve the autonomic nuclei. Because of involvement of autonomic nuclei, we will see autonomic symptoms, that is GI stasis, which is the constipation, sweating, increased secretion of GI fluids, increased secretion in trachea, arrhythmia, which is again deadly, and renal failures. It will also cause, and mainly causes, the involvement of motor nuclei, which will lead to spastic paralysis, bow back, and the involvement of respiratory muscle will again lead the person to death because it is an emergency and it will require an immediate ventilation of the person, basically by tracheostomy. Clinical features of neonate tetanus and maternal tetanus. First of all, why does it occur? Neonate tetanus has been seen in the communities which practice the cultural method of cutting the neonate cord, that is umbilical cord. In some places they use either grass or some unhygienic methods to cut the umbilical cord that lead the neonate to tetanus. What are its features? The first 2 days will be absolutely normal. In the third day to 28th day, spastic paralysis and rigidity in the child will be seen. How occurs the maternal tetanus? It is generally due to unhygienic practice of parturition, and also it can be seen in or after abortion. Generally, the tetanus occurs within the 6th week of these procedures. Progression and prevention. How it progresses? Now, the wound infection occur on the day 1. For 7 days to 10 days, there will be no symptoms. After 7 to 10 days, the toxin uptake will be started and vamp molecule will start lysing, which will lead to initial muscle ache such as trismus and myalgia. Within 24 hours after 10 days, it will lead to involvement of motor and autonomic systems, which will lead to spasm, that is generalized and local spasm, tachycardia and brachycardia, respiratory involvement, that is reduction in respiration of the person because of spasm of respiratory muscles, pyrexia, increased respiratory and GI secretions. This will remain for at least 4 to 6 weeks. After 4 to 6 weeks, the toxin amount or toxin will start degrading and the person will start reaching to the normal life. For prevention, most important for prevention is good wound care. That is, if there is a wound, it should be washed thoroughly and hygienic care of that wound should be taken off. And vaccination is the most important factor, and it is only the factor which has led 40 countries to eradicate neonate and maternal tetanus from their countries. India is also one of them. Clean and safe cord practices in neonates. For vaccination, 3 doses in infancy and then booster doses at age 4 to 7 or between 12 to 15 years. Then every 10 years, after every 10 years, booster doses should be administered. DTaP is the vaccine for children below 7 years and above 9 years. TD is the vaccine for children between 7 to 9 years. Now, the diagnosis and treatment. First of all, tetanus is nowadays very rare. So always rule out other diagnosis first. That may be due to poisoning of certain chemicals or paralysis due to some lesions or maybe anything. How do we diagnose this? Clinical features are the most important thing that we are gonna see to diagnose it. For confirmation, we can do culture. and the sample will be taken from wound, and we can see for IgG levels, immunoglobulin G antibody levels against the tetanus, but generally it does not rule out the diagnosis. Because it is an emergency, it becomes necessary that if tetanus is suspected, take the person immediately to ICU, because within few hours he may require ventilation. Administration of antitoxin should go immediately. There are two kinds of antitoxins that we have nowadays, that are equine antitoxin, which dose should be 20,000 units, and tetanus immunoglobulins that are made in laboratory. They are generally used in person who are allergic to equine antitoxin, and the dose of tetanus Ig is 3,000 to 5,000 units given through IV. Remove the site of infection. If possible, found the site of infection and remove it. Clean it thoroughly and remove the area which is infected. Administration of antibiotic. Metronidazole IV 400 to 500 mg is to be given for up to 7 days. Antispastic medication and respiratory support is mandatory, because the person will be lying for next 4 to 6 weeks into complete spastic posture, so it becomes necessary to use these medications, which are antispastic medications. They are benzodiazepine, clorazepine, thiobarbitals, IV magnesium sulfate. The special thing about IV magnesium sulfate is that it is titrated based on patellar reflex. What does that mean? We will decide the dose of this medicine by looking at the patellar reflex. If the reflex is more, we need to give them more dose of this medication. Morphine, fentanyl, calcium antagonist are required to control the arrhythmias such as tachycardia. Thanks for watching.